In 2024, prevalence of cystic fibrosis is approximately calculated to be 70,000 to 100,000 people affected worldwide. Cystic fibrosis, or CF, is caused by mutation in the CFTR gene, which disrupt the body's ability to regulate flow of salt and water in and out of cells. This leads to thickened mucus that clog the airways and cause persistent infection, limiting the ability to breathe over time. If you've seen the movie 5 Feet Apart, you've had a glimpse into the emotional and physical struggle faced by people afflicted by cystic fibrosis. But there's great news beyond Hollywood. Real-world innovation like CRISPR gene editing, CFTR modulator are transforming treatment and giving hope to thousands of patients afflicted by this condition globally.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrowth Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have an over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to this week Open Mic webinar. Here, I'm substituting for our chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen, who's a cardiologist. Here, I'm going to share with you a summary of what I discussed and present to members of our leadership team. So first, I started out by giving the definition of cystic fibrosis, and it is a condition, a genetic disorder affecting the exocrine gland, leading to persistent lung infection and limiting the ability for the patient to breathe over time. And then I went over a picture that shows the normal airway structure versus an airway structure of a patient afflicted by cystic fibrosis, which there are thick mucus secretion that block up the airway. So this picture gives you what the normal airway structure in the lung look like versus an airway structure of a lung that is being affected by cystic fibrosis. As you can see, for patients suffering from cystic fibrosis, like the structure that are delivering the airflow, they are being obstructed due to the mucus built up in the lungs. Cause for cystic fibrosis, as I shared, it is caused by mutation in the CFTR gene and is passed on by the autosomal recessive pattern. I then went on to describe the different types of cystic fibrosis, from classic cystic fibrosis, non-classic CF, CFTR related disorder, and then rank their severity. Now, there are different types of cystic fibrosis as shown on this slide. You have the most severe form, that is the classic cystic fibrosis. You have non-classic cystic fibrosis, which is milder symptom and it is later onset, and then cystic fibrosis related disorder. So this is the mildest form because it affects only one organ rather than multiple organs. I then discuss about the effect on the body. If it hit the lungs, if the exocrine gland being affected is the lung, then it will affect the respiratory system, causing obstructed airway, difficulty breathing, and chronic lung infection. If the exocrine gland is being affected, is the digestive system, then you see the patient suffering from malnutrition, pancreatic enzyme inefficiency or insufficiency. If it affects the reproductive system, then you have infertility in men. If the exocrine gland is in the digestive system, let's say the exocrine gland of the pancreas, then the patient will suffer from malnutrition due to pancreatic enzyme insufficiency. So this patient, they're still eating well, but then the food are not being able to be broken down to nutrients that the body can absorb because of the lack of this pancreatic. I then discussed the global impact of this condition. Worldwide, is afflicting 70,000 to 100,000 people worldwide. The sign and symptom I then discussed include persistent coughing, wheezing, frequent lung infection, poor growth, and poor weight gain. Despite that the patient has a good appetite, they just patients don't have the proper pancreatic enzyme to break down the food into nutrients. Also, salty tasting skin. Kind of symptom depending on which exocrine gland is being hit, which organ is being hit. If it's the lung, then you see frequent lung infection, coughing, wheezing. If it's the digestive system, you see poor growth, not inadequate weight gain despite that the patient have good appetite, and also salty tasting skin. Next, shifting gears, I discuss about the diagnosis that typically it is diagnosed with newborn screening. We do sweat chloride test, also genetic testing for CFTR mutation. Also, I then discuss about the treatment and outcome, and most of it are symptomatic treatment with airway clearance technique to remove the mucus. I then discuss the medication as well as drug to treat the CFTR modulation. Mainstay treatment is the treatment of the symptoms like clearance of the airway technique to remove the mucus from the lung. Next, I went over the commonly prescribed medication like ivacaftor, and then I discussed the new medication which involved the advancement in CFTR modulator as well as gene therapy that are currently being in clinical trial. These are the drugs that help to modulate or improve the movement of the chloride ion to the exocrine gland, which is geared toward treating the underlying cause of the condition. Also, antibiotic like inhaled antibiotics like tobramycin. Reason with it being inhaled is that it's more efficacious in treating the chronic infection in the lungs. New medical trend in this space, as I described, is personalized medicine, improved gene editing approach to CRISPR-Cas9, also enhanced drug delivery system through nanoparticles. A way to improve this condition is with early diagnosis and intervention, an integrated care team with personalized treatment plan, continued research and clinical trial for new therapy. We discussed advancement in biotech of different companies that would provide the most lucrative investment opportunity, and this will be company making gene editing approach like CRISPR-Cas9 to fix the underlying genetic defect, as well as drugs that focus on the CFTR underlying defect in the CFTR gene itself. Also, drug to improve the chloride transport, which work on a deeper level at the root cause rather than just symptomatic treatment. And that concludes my presentation. If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.